Resident doctors under the Association of Resident Doctors FCT chapter have embarked on a 7-day warning strike over unpaid wages and systemic neglect. The doctors describe the FCT health system as one plagued by long-standing systemic failures, calling for urgent and comprehensive reforms.
They urge the federal government to urgently tackle the growing challenges in the health sector, warning that continued neglect could lead to a systemic collapse. The association demanded swift intervention to address manpower shortages, non-functional equipment, poor working conditions, and unpaid staff allowances.
Well, let's tell you that hospitals are stretched thin, patients are stranded, and the doctors say they have had enough. But to discuss this, we have joining us President Association of Resident Doctors in Abuja, Dr. George Ibong joins us this morning. Good morning, Doctor.
Good morning. Good morning, and thank you for inviting me to be here with you.
Good. We're starting to see a lot of comments coming from especially the medical and health sector, where doctors are currently talking tough. And this is one that one would ordinarily not presume will happen in the FCT, especially saying that there seems to be a lot of development going on in the Federal Capital Territory, which happens to be also the place or the seat of power. But can you shed more light on what really is going on? You said there's been no recruitment in the FCT hospitals since 2011. Is that true?
Hello?
Can you hear us?
Yeah, I can hear you now. I don't know if you can hear me.
Yeah, I said...
yes, I can hear you properly.
All right, good, good. You did mention that there's been no recruitment in the FCT hospital since 2011. How true is that?
That's correct. Very correct. But the proper recruitment that was done in FCTA was in 2011. And since then, there has not been any recruitment. What we've had has been some scanty replacement, and the proportion of this replacement has been very minimal in such a way that it never bridged the gaps to those that have left the system. And that's the problem we are facing. And so therefore, we have a situation whereby we have like a doctor that will see a lot of patients, 30, 40 sometimes. Or you have a doctor that will do up to 7, 8, 9, 10 cesarean section in a day, and the same doctor will have to do the ward round, and the same doctor will have to do the call at night, and the same doctor is going to still write medical reports for patients. So, and it's beginning to be harmful, not just to the patients, but even to the doctor themselves. And that is why we had to take this action.
Okay, so I want you to give us a picture of what the typical recommended patient-to-doctor ratio is and what we have prevailing in Nigeria, or Abuja, if you prefer.
The FCT.
Yes, so let me put it this way. Actually, the WHO will say it should be maybe a doctor to 500 or 600. But in some countries like Cuba, for example, you may have like a doctor to like 230 patients, which is good enough. But in Nigeria, we're having a doctor to like 10,000 patients. And Nigeria is a country of about 300 million people, and we have less than 40,000 doctors working in Nigeria, including the specialists. So just do the math. 40,000, less than 40,000 Nigerian doctors taking care of 300 million people. That is very unfathomable. And that's the problem. And in Abuja right now, we have the same thing as well. So we have a situation whereby Abuja is the Federal Capital Territory. And then you have the neighboring states like Nasarawa, you have Niger State, you even have Benue State. We have patients coming in from there. So we have a population explosion when it comes to the amount of patients we see. So a doctor that works in Abuja sees a lot of patients. And like I said, we have records of one doctor doing up to 11 cesarean section in a day, just one doctor. And we have a situation whereby you have a doctor working in the whole hospital during the call hour covering the internal medicine department, pediatric department, gynecology department, and even the accident and emergency. So we see more than a lot, and it's beginning to seem impossible if we continue in this trend. It's not good for the patient, it's not good for us.
Absolutely. Dr. Ebong, you just painted a picture of very not a palatable work environment and the strain on the doctors. But beyond this, there are also issues of unpaid salaries, unexplained deductions. These are very serious allegations. How long have these issues persisted, and what has been the response from the FCT administration? Because I believe you must have interfaced a dialogue or let the FCT authorities know these issues that are affecting doctors.
Thank you. So we have always had dialogue with them. And let me put it this way, the minister also came to inherit this. So it has been a chronic systemic failure. So this is what I mean. Even if the minister leaves today, the next minister is going to inherit the same systemic failure. So the blame is not entirely on him. But because he's the minister at the moment and we believe that he can actually solve this problem, we want him to solve this problem. It is true that we have unexplained deductions from our salaries, and when we have those deductions, they are never paid back. And because you can't continue to trace whatever the money was used for, eventually you let that money go. We have doctors who are being owed salaries for up to 1 year in our hospitals. We have about 27 doctors as of now that have been owed up to 9 months' salaries, and we've tried to dialogue with them for the past 1.5 years on the same issue, and the outcome has never been positive. We have doctors who have passed their exams and they are consultants, and then they have to do the job of a consultant, but they are being paid as resident doctors, or they're being paid as medical officers. And so there's this accruing of their arrears that have not been paid over the years. And you know what happens when you accrue those arrears over the years? They become kind of big, and then the government wouldn't have, according to them, wouldn't have money to make those payments. So those payments are there 2, 3, 4, 5 years, and they don't pay. We have a case of the hazard allowance that we've not been paid since 2021. This is 4 years now. And when you talk to them about this thing, they keep telling us, okay, we'll see what we can do. We'll try to put this in the budget. We'll get back to you. And nothing is done. 1 year, 2 years, 3 years, 4 years, 5 years now. So, and that is why we didn't have a choice than for the Congress to say that we have to shut down until all these things, all of them, are resolved.
Well, if the strike ends after like 7 days and nothing changes, what's next? Are we heading toward a full-blown healthcare shutdown? Because we also recall that the resident doctors, aside the ones in the FCT, we also have the Nigerian medical doctors as well, who had given ultimatum, and still it seems nothing has been done.
Yeah, that's true. So the 7 days of warning shutdown is for us to dialogue and for them to do the needful. The Congress has mandated that if this is not done within the 7 days, then we'll have to reassess the situation and see what they have done on their part. And if nothing has been done convincingly, then we'll not have a choice than to go on a timeless shutdown. And that we don't know when we're going to call it off. And it's not like we love to do this, but it's becoming a harmful practice to the patient. We are beginning to record harmful medical practices on our patient. I have to say this, and it is because we are having doctors who are going through mental fatigue. We're having doctors who are self-medicating on antidepressant medications. We're having doctors who have to go through their work for 72 hours. I mean, just remember what happened in Port Harcourt. A young doctor that had to work for 3 days and then had to die because of what? Because of the stress of the job. In Abuja here, we have so many of those cases happening. We had 2019, we had a female doctor who was pregnant, who worked that long hours as well, and she died, even in the hospital, and she was pregnant. We have female doctors who have had 5 to 6 miscarriages because of the stress of the nature of the jobs that they do. We have doctors who collapse while seeing patients. We have doctors who collapse in the theater. These are our colleagues. We know them. They are our friends. And we keep saying that if we continue to follow this particular pattern, then the lives of our patients are in danger. Our lives as well are also in danger.
I mean, you really just highlighted very sad realities. Not too far or not too long ago, we heard the story of Dr. Femi Rotifa in River State University.
That's correct.
Of technology, right? So it's unfortunate that a number of these doctors, while saving lives of Nigerians, are either losing theirs or having to pay really steep prices. You know, as a final question, what would you like the dialogue to look like? Who are the necessary stakeholders that you want to come into a conversation with the resident doctors to get your desired outcome?
Yes, for the FCTA, the only person that can fix this problem is the Minister of State, Mr. Nyesom Wike. He's the only one that can fix this problem. And I would love him to declare a state of emergency. We will love him, the Congress will love him to declare a state of emergency on the healthcare in all the hospitals in FCTA, so that when he does that, then there'll be a waiver for him to do an immediate recruitment and employment of medical doctors, not just doctors alone, doctors, nurses, pharmacists, lab scientists, physiotherapists, everyone, every structure that makes a hospital to function properly. We want him to do that. We can't keep waiting for other infrastructure to be done before it comes to health. We can't keep waiting for bridges and roads to be finished before it comes to health, because life is just one. When you lose a life, you can't bring it back. And right now, our hospitals are not equipped enough to save the amount of life we are supposed to save. We don't have enough hands to save the amount of life we are supposed to save. And it's becoming traumatic to us that even sometimes the things we are needed to do, we cannot do them because we don't have enough hands or we don't have the required equipment.
Well, Dr. George Ebong, thank you for lending your voice to this, sharing your, this with us. We do hope that the Minister of the FCT sees how much of an importance this is and steps into the arena quickly to avoid further deterioration of the situation. Thank you for your time with us this morning.
Thank you so much. God bless you for inviting me.
Thank you.